Range Community Clinic is a faculty-run practice plan that serves the mission of the health sciences campuses by bringing care to people in rural and underserved areas.
Range Community Clinic is a healthcare practice with multi-specialty physicians, pharmacists, and nurses who are dedicated to teaching our students in a clinical environment.
Range is really here to reach out to patients who otherwise don't have access to care for one reason or another. We're not here to replace primary care at all. There's wonderful primary care opportunities throughout the state. We are really there to try to re-engage patients with existing primary care and try to help keep them healthy and avoid negative health consequences.
To have a greater impact, you need to be more embedded in the community. So the opportunity lies in working with the community and with community leaders, identifying what the gap is, what the need is, and then moving into that gap so that it's community-driven healthcare rather than community-based healthcare.
Once we understand their needs, we're going to bring care to them wherever they are. Accessibility is one of the big issues for people in this state, and that's why instead of having people come to us, we want to bring our services to them to make it more accessible.
Our two clinical programs right now are street medicine and the mobile medical unit. So the mobile unit goes out to rural communities. We can do pretty much anything you can do in a primary care doctor's office. And we try to see people for their immediate needs and try to connect them back in for follow-up to existing local health services.
We've been fortunate actually to have two donations for our mobile unit program. The first was Mr. William Cressetto from Othello. He donated the funds for our first mobile unit, and we affectionately call it Bill. And his goal was to ensure that healthcare was brought to those rural and underserved communities of Washington. Funding for our second mobile unit came from Mr. Albert Ravenholt. Again, another donor who saw the need for healthcare in rural communities and paved the way for that to happen.
Street medicine is probably one of our most amazing programs that speaks right to the heart of our mission. It's a program where we bring care to homeless people in and around Spokane, and that's primary care, and obviously in the pandemic we've also brought COVID testing and COVID care to homeless people as well.
We will try and have an impact on their concern at the time. That may be doing some wound care, it may be checking vital signs, it may be just talking to them and reassuring them that we'll help them. In the long term, we would hope that by initiating that first encounter, breaking the ice, establishing a relationship, that we could eventually help that to translate into stability. Whether that is getting them back on their blood pressure medicine and stabilizing their blood pressure and reducing their risk of heart attack and stroke, or it's getting them back on a mental health medication that helps to stabilize them. And then hopefully, as time moves forward, that will take them to the next step. Shelter, housing, regular health care visits.
Every student that's been on the street medicine team has voiced how moved they are and how much of a learning opportunity that was for them. Taking the time to understand people and their needs and sort of their living conditions and their whole situation is pretty profound for students.
These kinds of opportunities are critical. I know they were critical in my education, and they led me down a path of community-based practice.
Even if they don't go into a range health or serving underserved population setting, they had that experience, and that becomes part of their professional makeup, which then allows them to treat patients wherever they are with, I believe, more compassion and care.
One of the key elements of health science professional education is this notion of interprofessional training. And what that means is it means bringing different health science professionals, MDs, pharmacists, nurses, psychologists, into a team-based approach to care, so that when you provide care to people, you're doing it in a whole person kind of way, not just a doctor dealing with certain physical ailments, but also the medication therapies needed, and also the mental health things that are needed to make a person well. And so Range Community Clinic from the start is that interprofessional team-based care approach to making people well.
The training they get as a part of Range Health is like no other classroom training that we could provide, or even clinical training that we provide. It's really a unique opportunity that gives our students wonderful experience.
We're just at the beginning of our journey, and eventually we want to serve all 39 counties, and we're going to do that through telehealth, through mobile units, and a few bricks and mortar buildings as well.
Our overall goals is to be operating in and around all of the campuses of WSU where our faculty providers are. So not just in Spokane and in the Spokane region, but also in Everett and Tri-Cities and Vancouver and Yakima. And so in order to do that, we're going to have to create those investment capital through either philanthropy or earnings in the practice, if you will. Make those investments in getting into those places.
Range Health is really a shining star in how we care for people in rural environments. And there's a shortage of healthcare providers in these environments. And so the services that Range can provide in those environments is crucial for public health.
The lifeblood of what we do here at the Health Science Campus is to train future healthcare professionals in the care of patients. Anytime we can bring patient experiences to our students, and particularly in the way in which they all get to come together and work together and learn together, that's a really amazing thing. And so I think that's one of the reasons we're so passionate about this, is not only can we bring better health to Washingtonians, but we can also bring better education to all of our students right here.